What is diabetes? With diabetes such an epidemic today, it is essential that you know exactly what it is. Why? Well, to prevent getting diabetes yourself, that is. In layman terms, diabetes is the inability of the body to process sugars properly. When we eat or drink, our pancreas produces a hormone called insulin. Insulin is released into the blood and helps to regulate the amount of glucose, sugar, in the bloodstream. Diabetes is a condition where this process does not function correctly. The reason why diabetes occurs is that no insulin is being produced, often called type 1 diabetes, and requires the sufferer to use insulin injections, or insulin is produced but the body becomes resistant to it. This renders the insulin ineffective. This is normally called type 2 diabetes and is rapidly becoming more common. The danger is that while diabetes is not immediately life-threatening, the long-term effects of high blood sugar can be damaging to one's health. Uncontrolled diabetes and prolonged high blood sugar levels can, in later life, cause problems to many organs including the kidneys, eyes, nerves and the heart. This may sound grim, however, controlling blood sugar by a combination of medicine, diet and exercise will vastly reduce the long-term complications. Recent research shows that 2 in every 100 people have diabetes. Alarmingly, half of these people do not even know they have it. Many people have diabetes without being aware of it because someone with diabetes looks no different from anyone else. How do you find out if you have diabetes? The simplest way to check if you have diabetes is to arrange a blood sugar check with your doctor. A tiny sample of blood, obtained by pricking a finger, is checked using a small electronic tester. A normal blood sugar level is generally between 72 to 126 mg per deciliter or 4 to 7 mmol/L, where 1 mmol/L equals 18 mg per deciliter. If the body is unable to keep the blood sugar level within these limits, then diabetes is diagnosed. Diagnosis of diabetes can occur out of the blue during a routine checkup, but more often it follows from the sufferer experiencing the symptoms of diabetes. These symptoms can be many or few, mild or severe depending on the individual. Common diabetes symptoms. Loss of weight. Glucose is the form of sugar which is the body's main fuel. Diabetics cannot process this properly, so it passes into the urine and out of the body. Less fuel means the body's reserve tissues are broken down to produce energy, with a resultant loss in weight. Thirst. Often it seems no matter how much you drink, your mouth still feels dry. The problem is compounded before diabetes is diagnosed by sufferers drinking huge amounts of sugary drinks. Of course, this only increases the blood sugar level and leads to increased thirst. Urinating more often. Sufferers need to urinate often and pass large volumes each time. In addition, this symptom takes no account of time, so sleep is constantly disturbed by having to visit the bathroom during the night. It is a mistake to think this is caused by increased thirst and drinking more. On the other hand, high sugar levels in the blood spill over into the urine, making it syrupy. To counteract this, water is drawn from the body, causing dehydration and therefore thirst. If you have experienced any of these symptoms, it does not necessarily follow that you are diabetic. However, it might be advisable to visit your doctor to be sure. If it does turn out that you have diabetes, please do not panic. It can come as a shock and it will mean some changes in your life. While it is incurable, it can be treated so the long-term complications are reduced or even eliminated. By knowing exactly what diabetes is and recognizing the symptoms early on, you can prevent it from ever building up within you. Start today by monitoring your health and daily eating habits. Or as they say, preventing is better than finding a cure later on. This video is brought to you by organic-potion.com.